Hello everyone. So yes, can you hear me? So please let me check and when we can start the session now. So yes, aspirants, can you hear me so that we can start the session now? Yes, so yes. So yes, I am audible. Yeah, okay, so everything is clear and we can start the session now. So hello everyone. Yeah, so what is the plan today is that firstly I will complete the whole joints of the lower limb on the YouTube session live on Let's Crack NEET PG channel, our Let's Crack NEET PG channel. And after completing the details of joints of lower limb, in which I will cover up knee joint, hip joint, ankle joint and all other joints in brief, and then it will be followed by a special class. So that special class will be taken on the Unacademy app. So for that you have to download the Unacademy app and I will conduct MCQs, means it will be a quiz kind of thing. I will not give detailed explanation because already the theory part will be covered in the YouTube sessions. So that will be of approximately 23 to 25 MCQs related to this topic. So this is the sequence which is going to start so that maximum benefits can be taken by the aspirants, because due to the suggestion, it's because of the suggestion of few aspirants, they told that sometimes it's better that you complete the topic and then it should be followed by an MCQ session. So I think it will be helpful for you. Any doubt you can write in the message box and we will proceed like this. So today's topic is joints of lower limb. This will be targeting the NEET PG 2022 examination. So yes, myself Dr. Monalisa, and my code is ANAT10, which can be used by you for getting 10% discount if you are going for the plus subscription or you want to be present for the free live session. So maximum benefits can be taken from the free live sessions present on the Unacademy platform, and I would like to elaborate this so that you should be aware of all these points. So it's an interactive session where the learners interact among themselves. So the learners can interact and among with the educators, and this is a very useful thing. Why? Because they can ask their doubts live itself when the session is going on, and this will be exactly like we are in a classroom, we are in a lecture theatre. So polls are conducted among the learners. So for example, today itself, if I take an example of today, I will complete the YouTube session, I will complete the entire topic, and then it will be followed by special class on the Unacademy app where all the MCQ sessions and the polls will be conducted. So that will again be very useful for you. My dear aspirants, raise your hands and get your doubts cleared right itself when the session is going on. Never ever miss a session. What does that mean? This means, for example, if you start liking my session, if you want to see my sessions of anatomy on the Unacademy app, for that what you can do, you can follow me on the Unacademy app and thereafter you will get entire notification regarding my sessions. So lecture notes, so download lecture notes and get access to record sessions. So you will get the access and you will get the PDF notes followed by after the completion of session. This is the best part. This is the best part, and this is present on the free platform of Unacademy. That is another best part, not only plus but also on the free platform. So just grab this opportunity, my dear aspirants. So Atharva Dalvi, hello Atharva. So the plan is that I will cover the entire topic of joints of upper limb. It will joints of lower limb. Sorry, I will cover up the topic of joints of lower limb, and it will be followed by special class MCQ session. That will be taken 6 PM is the timing, and the session will be of 60 minutes covering approximately 23 to 25 MCQs. And this will be from the topic which I will just cover up in the YouTube session. So you should all download the Unacademy app after I complete the session on YouTube and be present on the special class, because let's see how we can proceed, and you will also know how much you have grasped the topic. So my dear aspirants, now let me talk about the plus subscription. What are the benefits of plus subscription? You can access both live and recorded version. You can study from the top educators of Unacademy platform You can compete in live test and quizzes, study on the device of your choice. You can access more than 25,000 MCQs. Coming soon is the printed notes provided. So with 1 year of subscription and more, you will get printed notes. That is another useful point, and that is coming up soon with the subscription of Unacademy. So go for the subscription, use this code ANAD10 and avail an opportunity of 10% discount. So on Plus subscription, all 19 subject targeting for your entrance exam is covered in a very systematic way, so that you can get a better rank in the competitive exam. So what about the iconic subscription? When I am talking about iconic subscription, it means that you are going to get the benefit of best two platforms in the field of medical preparation examination. So that is the live sessions of Unacademy on the Plus platform of all entire 19 subjects taken by the top educators of Unacademy platform, along with the prep ladder. So that means you will get the video recorded lecture of the prep ladder dream team. You will get the integrated essentials, clinical integrated essentials QBank. 3 can be accessed by you. Rapid revisions, tags, treasure, dream notes, printed dream notes of the prep ladder team. So yes, my dear aspirants, and again you can use my code ANAD10 for availing an opportunity of 10% discount. I also want to show you the slide. Why the slide? Because there is a comparison of Plus subscription compared with the iconic subscription. So you can compare the benefits, and you can see the iconic subscription is having more benefits than the Plus, means two platform benefits is added on. So what I want that if you are preparing for next examination, INICT, NEET PG, FMG, just go for the iconic subscription, and you should take the subscription. If you are a student of first or second year, you can take a subscription of 4 years or 3 years, and if you are a student of final year, you can go for 1 or 2 years. So yes, that totally depends on you. Now what about NEET PG subscription? So I just want to give you information about NEET PG subscription, because a discounted rate is going on. Already the discount is there of 10% by using the code ANAD10, another 10%. What does that mean? A discount of more than 20%. So if you are planning to take the subscription, this is the right time. Just go for it. Now, I would also like to give you an information of the highly updated effective QBank on the platform of Unacademy, where more than 25,000 MCQs are there. Of all 19 subject, which is based on latest pattern exam, includes a detailed description. You can again use this code ANAD10 and get an opportunity of 10% discount. My dear aspirant, which are the batches which is starting? Focus FMG batch, high yield revision series, target NEET PG 2022 batch, which is already started. And my dear aspirants, also in the November session and the other batch for FMG 2022 June session, comprehensive course of all 19 subjects is starting. The course is of 6 months, in which entire anatomy is taken by me. I will cover up the entire anatomy in the session of 34 hours. So just grab it and let's start with the topic. So let's start firstly with the topic, that is knee joint. Okay, so let's start with the topic. So all of you should be present for this theory session, and after this theory session we will have an MCQ session on the special class. Okay. So yes, in this diagram you can see the articular surface of the knee joint. Actually, when I am talking about knee joint, so this knee joint is the most complex and compound joint in our body. So the first thing is you have to know the meaning of compound and complex. Okay, these two terms are used, that it is a complex joint and it is a compound joint. So that concept should be clear, that what I mean by the word compound and what I mean by the word complex. Why knee joint is the most complex joint in our body? My dear aspirants, generally the thing is that why it is compound, because more than 2 bones are articulating. Okay, more than 2 bones are articulating, more than 2 bones. So it is called as compound joint. Okay, so knee joint is a joint which is formed by articulation of, you can see here, lower end of the femur. So femur is articulating with the upper end of the tibia, so 2 bones, and in the anterior aspect you can see the patella is also articulating. So you can clearly visualize that it's not just the 2 bones which is articulating to form the knee joint, it is more than 2 bones, so it's an example of compound joint. Okay, why complex? Anyone wants to give their answer in the messages also, they can give though. Okay, so I am telling it's a complex. Why? Because in the interior of the joint cavity, when you will see the interior of the joint cavity of the knee joint, there is presence of menisci. There is two menisci present, that is medial and lateral menisci. The other name of medial and lateral menisci is semilunar cartilages. So menisci are also called as semilunar cartilage, and this will divide the joint cavity into two compartments. So knee joint is divided into two compartments. Okay. So let me tell you why. Absolutely right, Mohammed. Why knee joint is complex joint? So it will divide it into two compartments. So the space which is lying, or the joint cavity which is lying above the level of semilunar cartilages, is called as meniscofemoral compartment. So two compartments are there. One is meniscofemoral compartment, and the other is meniscotibial compartment. So two compartments are there, meniscofemoral and meniscotibial. Yes, Hussain, you are absolutely right. Yes, Hussain, both of you are absolutely right. So now my next point is that if anyone wants to give the reply, they can give that it is a complex joint because in the upper compartment, we know that meniscofemoral is the upper compartment and meniscotibial is the lower compartment. So in the upper compartment, the movement which is taking place is flexion and extension of knee joint. Flexion and extension. Okay. So in the upper compartment, flexion and extension of knee joint is taking place, and in the lower compartment, medial rotation and lateral rotation is taking place. Medial and lateral rotation is taking place. So this is the reason that knee joint is called as. So actually what happens in knee joint, as we know, the knee joint is, if we tell what type of joint, so it will be a modified hinge joint. Okay. So in why it is called as modified hinge joint, because we know that in transverse axis flexion and extension takes place. Along with this flexion and extension of knee joint, there is also conjunct rotation, that is medial and lateral rotation, and because of this knee joint is considered to be the complex joint in our body, most complex joint in our body, because of the presence of semilunar cartilage dividing the joint cavity into the two compartments. I think the concept is clear. Now let's move on to the other type of joint. So in one line you can just tell, if I want to tell you the type of joint, the answer will be it's a modified hinge joint. It's a modified hinge joint. So yes, any doubt you can ask me, dear. It's a modified hinge joint. Okay. Yes, it's a modified hinge joint. Now, so this is the type of knee joint, but there is certain articulations also. As you can see, the upper end of femoral condyle is articulating with the lower end of the tibial condyle. So this will lead to form, so this will lead to form condylar articulation or condylar joint. So in between the condyles there is condylar articulation, and in between femur and patella there is saddle type of articulation, saddle type of articulation. So saddle type of articulation is between femur and patella, and condylar articulation is between the condyles, okay, between the condyles of femur and tibia. Okay, so is it clear? Let's move on to the next. So next point is that we have to know, so I also want to elaborate every kind of, I want to give you the detail of all the ligaments in relation to knee joint, that is the primary ligament and the secondary ligament. So let's firstly enumerate it. So first thing is we have to enumerate all the ligaments in relation to knee joint. So please write down the heading, ligaments of knee joints. Okay. So the ligaments of knee joint, so firstly I will write all the primary ligaments of the knee joint. So the primary ligaments of knee joint is, please write down, the primary ligaments are fibrous capsule of knee joint, medial and lateral collateral ligament, medial and lateral collateral ligaments, My dear aspirants, the other name of medial and lateral collateral ligament is tibial and fibular collateral ligament. We have also got anterior cruciate ligament and posterior cruciate ligament. We have also got ligamentum patellae. We have got semilunar cartilage, that is meniscus, which is also acting as a ligament for, and other than that few secondary ligaments are arcuate popliteal ligament, oblique popliteal ligament, we have got transverse ligament, we have got coronary ligament. So, what you can see, these are the total ligaments which is related to knee joint. So, I will briefly describe each one of this. So, fibrous capsule, medial lateral collateral ligament, anterior posterior cruciate ligament, ligamentum patellae, semilunar cartilages, the arcuate popliteal ligament, the oblique popliteal ligament, the transverse ligament and the coronary ligament. So, altogether we have got, yes, altogether we have got 9 ligaments. So, I will like to elaborate each of it. Okay. So, let us move on with this. So, firstly, in the diagram you can focus about the fibrous layer of the joint capsule. Fibrous layer of the joint capsule. So, in this diagram what you can see, this is showing the interior of the knee joint cavity, which is clearly seen in this diagram, the interior of the knee joint cavity. And so, here this is the joint capsule fibrous layer. Actually, when you will see the fibrous capsule, on the inner aspect of the fibrous capsule there is synovial layer. So, there is synovial layer which is lying on the inner aspect of the fibrous capsule, and because of the presence of these two structure together, when we take the fibrous capsule of knee joint along with the synovial membrane lining it, a term which is used is articular capsule. So, this together is called as articular capsule. Now, in the joint cavity, actually capsular ligament of the knee joint is thin and it is having some deficiency also. Anteriorly it is having a deficiency for suprapatellar bursa, ligamentum patellae, and its attachment on the femur is approximately, actually it is half to 1 centimeter beyond the articular margin, and laterally it is also enclosing the origin of popliteus muscle. Lower down it is attached onto the tibia approximately half to 1 centimeter beyond the articular capsule, and posteriorly it is having a gap of popliteus tendon. On the inner aspect of the fibrous capsule there is a lining membrane, that is synovial membrane, which will secrete the synovial fluid which is required for the lubrication of the joint cavity. Now, this synovial membrane is seized at the ends of the articular cartilage. So, can you see here, there is no synovial membrane over the articular end or articular cartilages or onto the medial and lateral menisci. So, these are certain key points about the fibrous capsule. So, let us write it. Here also you can see the joint cavity is filled with the synovial fluid, articular, and here the same thing which I have told you, articular capsule is taken together, the fibrous capsule along with the synovial membrane. Okay, my dear aspirants, so let us write the details which I have told you and then we will proceed with the next ligament. So, let us start with the first ligament, fibrous capsule. Fibrous capsule. Fibrous capsule, it is very thin. Key points. It is having anterior deficiency. So, anteriorly it is deficient and it is replaced. Anteriorly it is deficient for quadriceps femoris muscle, patella, ligamentum patellae. Ligamentum patellae. Okay, ligamentum patellae. Okay. So, actually these are the things, we will go with the details of this, where you will see the why it is called as the why it is having this deficiency. Actually anteriorly it is deficient. Why? Because these are the structures which is lying on the anterior aspect. Just a minute. Okay. So anteriorly it is having a deficiency of quadriceps femoris, patella, patellar ligament and the patella. Okay. 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 So yes. Now coming to the attachment of femur. Okay, yes. Hussain, synovial fluid contains. Synovial fluid is required for lubrication. It will secrete synovial fluid which will have egg-like consistency, and it will having proteins. It will have protein and which will required for the which will be required for a smooth coordinated movements. Okay. So it will have blood plasma, proteins and other synovial fluid will have hyaluronic acids. These are the secretions which will give lubrication to the joint cavity. Okay. And actually in diseases like osteoarthritis and all, these fluid secretion is reduced, and because of less secretion of this fluid, there is less lubrication. The articular surface will not be smooth, will have friction. So one surface on the other surface will have friction. It will lead to the formation of new bone spicules, that is called as osteophytes, and the ultimate goal of treatment is the joint replacement. Okay. So let's firstly complete. Okay, is it okay, Hussain? So let's start with this topic. So yes, femur. Now I am talking about the attachment on the femur. So let's talk about the attachment of the femur, where this is attached onto the femur. So it is attached half to 1 centimeters beyond articular margins, laterally encloses origin of popliteus muscle. Laterally encloses origin of popliteus muscle. Okay, these are the key points which is always asked in the examination. So these are the key points which is always asked in the examination. Now coming to the tibia, the same thing, attachment of tibia half to 1 centimeters. It is attached beyond the articular margin, And if you remember, I told you that posteriorly it is having a gap for the passage of popliteus tendon. Posteriorly it is having a gap for popliteus tendon. Got it? Done? Now coming to synovial membrane. Now coming to the point, that is synovial membrane. So one of the student has asked also. So let me complete about synovial membrane now. So no, please note down, when we are talking about synovial membrane, it lines the inner aspect of fibrous capsule, and this is very important to note that it ceases at the periphery of articular margin. It ceases at the periphery. It ceases at the periphery of articular margin. And actually it is also important point to note down, it is not covered over the, it also ceases at the medial and lateral meniscus. What does it secrete? It secretes synovial fluid. What does it secrete? It secretes synovial fluid, which is required for lubrication. It is made of, it is required for lubrication, it is made of hyaluronic acid, lubricin, proteases, collagenases, and these are structures are required for lubrication. These are the structures which is required for the lubrication. So is it okay, Hussain? So yes. So now I think the concept of fibrous capsule, synovial membrane and the synovial fluid is cleared. Okay, okay Hussain, great. And I would also like to tell everyone, those who are listening to this session, that we will follow this YouTube session by a 6 p.m. special class where MCQs will be discussed related to this topic only. Now the next ligament which I want you to explain, so the next ligament which I want you to explain is ligamentum patella. Okay, ligamentum patella. So let's focus on ligamentum patella now. So in this diagram you can see here ligamentum patella has been shown. This is the ligamentum patella which you are seeing. Actually it is an extension of tendon of quadriceps femoris. So this is the tendon of quadriceps femoris muscle, the muscles of anterior aspect of the thigh, which is extended onto the knee joint, forming ligamentum patellae. So ligamentum patella, second one. Let's focus on the second ligament. Ligamentum patellae is actually the tendon of quadriceps femoris. It's actually the tendon of quadriceps femoris muscle. It is actually the tendon of quadriceps femoris muscle. So approximate length is 7.5 centimeters, width is 2.5 centimeters. And where it is attached, so actually when you will see the apical part or apex part, it is attached to the upper tibial tuberosity, which you can see here. It is attached to the upper tibial tuberosity. So all of you can write notes along with me, because what are the positive point, what is the positive point about the special classes is that you already get the PDF notes, but when we are talking about, when we are taking the sessions on the YouTube, you should be attentive and you can write the notes here itself. All the diagrams and all, if you want to revise, you can again see the session, revise it. Now, so this is about the ligamentum patella. What is the next ligament? So we will talk about the next ligaments, that is the collateral ligaments. Okay, so we have got two collateral ligaments we have got. So let's focus on to the third ligament, that is tibial and fibular collateral ligament. So firstly I would like to describe the tibial collateral ligament. Tibial collateral ligament is also called as the medial collateral ligament, which is lying onto the medial aspect. Now, actually when we talk about tibial collateral ligament, it is made of superficial and deep part, and this superior aspect, if we talk about its attachment superiorly, so superior attachment of tibial collateral ligament, as you can see in this diagram, let me first explain here. So see here, this is the tibial collateral ligament and this is the lateral collateral ligament. So let me first explain and then I will write the notes, don't worry. So let me explain each one of it. Tibial collateral ligament and the lateral collateral ligament. Okay. So what you can see, can I slightly enlarge this diagram? So let me enlarge it and explain it clearly. So if you will see this diagram, you can clearly appreciate that the upper attachment is on the medial condyle of the femur. From here, it is diverging as a two parts. One of its part is going towards the tibia lower end. other one is fusing with the medial meniscus. So actually tibial collateral ligament is having two parts, superficial and deep. Superficial part will cover up the proximal medial aspect of tibia and the deeper part will merge with medial meniscus. Okay. And here what happens, it is overlapped by the sartorius semitendinosus muscle and also by the gracilis muscle. Okay. So actually, and it is important to know that on the medial aspect it is also having the nerves and the vessels related. Same way on the lateral aspect, you can see lateral collateral ligament is just having one part. Superior attachment is in the lateral condyle of femur and lower down it is attached to the head of fibula. So it is not having two parts. So let's write the same thing. Tibial collateral ligament. Superior attachment. So superiorly it is attached to the lateral epicondyle of femur. Superficial part covers inferior medial genicular nerves and vessels. Inferior medial genicular nerves and vessels. Got it? And the other important point about the superficial part is that superficial part of the medial or the tibial collateral ligament is that it is overlapped by the tendons of sartorius muscle, gracilis muscle and that of ST for semitendinosus muscle. Now, when we are talking about the deep part, so when I am talking about the deep part, as you can see in the diagram also, the deep part of tibial collateral ligament TCL in short form is blends with the medial meniscus of knee joint, medial menisci. Now, other important point for MCQ, all of you please note down, this is an important point for MCQ, is that the tibial collateral ligament is actually degenerated tendinous insertion of the adductor magnus muscle, ischial component of adductor magnus muscle. So please note down, it is important for your MCQ session also that tibial collateral ligament is actually degenerated tendon of insertion of hamstring part of adductor magnus muscle, hamstring part of adductor magnus muscle. Now coming to the fibular collateral ligament, which is also called as lateral collateral ligament. Fibular collateral ligament, which is also called as lateral collateral ligament. As we have seen, it is not having two parts, it is just having one part. One is the superior attachment. So superiorly it will be lying on the lateral side. So superior attachment will be lateral epicondyle of femur. And as lower down you have seen, it is inferior attachment will be, inferiorly it is attached to head of fibula. Inferiorly head of fibula. Other important point is that, important relation is that it is embraced by the tendon of biceps femoris muscle. All these points are very important for MCQ. So I am stressing this and I am writing the notes for you. So you should also note down this crux point. Okay. The other important point is that it is separated from fibrous capsule. So it is not blending with the fibrous capsule. It is separated from the fibrous capsule. It is separated from the fibrous capsule. It is separated from the fibrous capsule by tendon of popliteus muscle, by the tendon of popliteus muscle. And it is related to lateral genicular nerves and vessel, lateral inferior genicular nerves and vessel. It is also forming a separation from the lateral genicular nerves and vessels. So, we have done with the collateral ligaments also. Next, I want to tell you about the cruciate. No, other one point I just forgot. Please note down the other point. This is also important for your MCQ session, that actually the fibular collateral ligament is, anyone wants to give the answer? Fibular collateral ligament is degenerated tendon of which muscle? So, fibular collateral ligament, note down, fibular collateral ligament is degenerated tendon of peroneus longus muscle. Done. Now, next important ligaments, the primary ligament required for antero-posterior stabilization of knee joint will be the cruciate ligament. So, let us discuss about the anterior and posterior cruciate ligament. Cruciate ligament. So, we have got two cruciate ligaments, anterior cruciate ligament, and we have got posterior cruciate ligament, which is required for antero-posterior stability of the knee joint. It is very important for antero-posterior stability of knee joint. And the attachment is also very important. Actually, it is named anterior or posterior. The term anterior and posterior is given to the cruciate ligament in respect to its attachment to the intercondylar area of tibia. If it is attached anterior in the intercondylar area of tibia, it is called anterior. If it is attached posterior in the intercondylar area of tibia, it is called as posterior. So, that is the naming, how it is done. Okay. Now, let me first show you this diagram, and then I will give you the details of the cruciate ligament. So, here the two cruciate ligaments is already seen. So, see here, this ligament is the posterior cruciate ligament. This is the posterior one, and this is the anterior one. This is the anterior one. So, this is the posterior cruciate ligament and this is the anterior cruciate ligament. Okay. Now, you can see here the two is crisscrossing, crossing each other. The cruciate ligaments are crossing each other, crisscross. And let us talk about its attachment. So, let us tell about, firstly I would like to tell you about the anterior cruciate ligament. So, and as I told you, it is called as, so this is the view which you are seeing the knee joint cavity from the posterior aspect. So, you can see the posterior and anterior cruciate ligament very nicely, and this is the view of the knee joint from posterior aspect. Let us talk about each of the ligaments attachment. So, let us talk about firstly the anterior cruciate ligament. So, write on the heading, anterior cruciate ligament. Anterior cruciate ligament. Anterior cruciate ligament is attached. Anterior cruciate ligament is attached on the anterior intercondylar area of tibia. On the anterior intercondylar area of tibia. From here it ascends upwards, backwards and laterally to be attached to posterior part of medial surface of lateral condyle of femur. So, this is the whole attachment which I have told you. This is the whole attachment of anterior cruciate ligament attached to the anterior intercondylar area of tibia. Then it ascends upward, backward, laterally and get attached to the posterior aspect of medial surface of lateral condyle. Thereafter, done. Next is its function. What is the function? So, this is the ligament which is taut during, anterior cruciate ligament is taut during extension of knee. Now let's talk about the posterior cruciate ligament. So let's talk about the next one, that is the posterior cruciate ligament. So again when we are talking about posterior cruciate ligament, अगर इसकी भी attachment की बात करें तो let's posterior cruciate ligament. So write down the heading, posterior cruciate ligament, posterior cruciate ligament. So when we are talking about posterior cruciate ligament, it is attached to the posterior part of intercondylar area of tibia, and from here it passes upwards, forwards, medially and get attached to anterior part of the lateral surface of medial condyle of femur, Got it? Medial condyle of femur. Now, what's the function? So when we are talking about again the function is this posterior cruciate ligament is stout during flexion. It is stout during flexion. My dear aspirants, any doubt you can ask me. So you must be wondering that ma'am is giving so much detail about each and every ligament, because these are very important. Knee joint is a very important ligament, and all these crux points are definitely asked in the MCQ. So we have to study it in detail. Okay. Now coming to menisci. The next is the menisci. So I can firstly I would like to show you this diagram where you can see both the medial and the lateral menisci. So this is the medial one and this is the lateral menisci, and if you appreciate, the shape of medial meniscus is semilunar and lateral meniscus is somewhat O or circular. So lateral meniscus, as you can see, is somewhat circular in shape and medial meniscus is semilunar. Other key point which you can appreciate here is the extension also. Okay, so this is quite adherent to medial collateral ligament. It is not quite adherent to lateral. Actually, popliteus muscle tendon is there. So also I want to I have already told that these are important structures. So one more important point is that about cruciate ligament, I just didn't told you about the cruciate ligament, that is it's an intracapsular and extra synovial structure. So all of you please note down, abhi just हमने क्या complete किया है, cruciate ligament. So this is also important for MCQ. So please note down, both anterior and that of posterior cruciate ligaments are intracapsular structures. They are intracapsular structures. Intracapsular structures and extra synovial structures. Same way, menisci is also lying inside. So they are also intracapsular structures. Menisci are also intracapsular structures. Now, what you can appreciate here, actually, you can see here the meniscus are having, this is the anterior horn of the, and this is the posterior horn. But when you will see here, let me just rub this. I would like to concentrate about the lateral menisci. So if you will see, let me slightly enlarge this diagram. Okay, is it okay? Yeah. So see here, this is the posterior. So here you can see this is the posterior horn, this is the anterior horn. If you will see from the posterior horn of the lateral menisci, I am talking about the lateral menisci, there is extensions which is going, and so from the posterior horn there is small ligaments which is extending from the posterior horn of the lateral meniscus and get attached to the medial condyle of femur. So these extensions are going in relation to posterior cruciate ligament. So see here, this is posterior cruciate ligament. Okay, so this is the posterior cruciate ligament, and you can see the two extension. I would like to use two extensions. So this is the, I am using blue color for one extension and I am using yellow color for the other extension. So can you see, and in between the cruciate ligament, I am just showing you, this is the cruciate ligament. So see here, in between lies the cruciate ligament. So what you can appreciate, the ligament which is passing, yellow color ligament which I am showing, that is passing anterior to posterior cruciate ligament, is called as anterior. So this will be anterior menisco-femoral ligament, and which is passing posterior to posterior cruciate ligaments, this will be posterior menisco-femoral ligament. And there is a term used for both of these ligament. Anterior menisco-femoral ligament is called as ligament of Humphrey, and posterior menisco-femoral ligament is called as ligament of Wrisberg. Okay, thank you Sahab. So please thank you Asaf Sahab. Okay, so yes, let me know, is the concept clear? Have you understood the concept of Wrisberg ligament and the concept of the Humphrey ligament? So let me write this. So all of you please write down. Menisci, we have already seen the medial and lateral menisci in detail. So I am talking about the lateral menisci. So we have already seen and the medial and lateral menisci. So one of the important point about the lateral menisci is posterior horn of lateral meniscus is connected to medial condyle of femur by two ligaments. Okay, so let me write it. The first ligament is ligament of Humphrey. The ligament of Humphrey passes anterior to posterior cruciate ligament, and the other one is ligament of Wrisberg. The ligament of Wrisberg passes posterior to posterior cruciate ligament. If we will see the relation, it is passing posterior to posterior cruciate ligament. So this is how you can remember these points. So H is alphabetically anterior to W. So if you go alphabetically, dear, H is alphabetically anterior to W. So H comes anterior. So it is anterior meniscofemoral ligament, and W comes after. So it is posterior meniscofemoral ligament. So what is the other name of ligament of Humphrey? It means anterior meniscofemoral ligament. What is the Wrisberg? It is posterior meniscofemoral ligament. So is it okay everyone? Any doubt, let me know. Okay, so great. So done with this? Okay. So we have done with the meniscus also. One more point is the key point to know, that I have again told you, this is also important for MCQ. We have just now seen that when we are talking about medial menisci, it is attached to, it is adherent to which ligament? It is adherent to medial collateral ligament. That will be adherent to medial aspect of fibrous capsule. So medial menisci is more prone to injury because it is more fixed. But this is not the case for the lateral menisci. Actually, when we are talking about lateral menisci, the lateral menisci is separated from, it is not adherent to lateral collateral ligament, it is separated by, it is attached to popliteal tendon. So it can be moved in cases of any kind of injury. So it is less prone to injury. Done? Now coming to the other minor, so we have finished all the ligaments in respect to knee joint, that is the major ligaments. Now I am talking about few minor ligaments. So actually one of this ligament is oblique popliteal ligament, and MCQs in the previous year has been asked that about popliteal ligament, oblique popliteal ligament, so it is important. So the thing which is quite clear here is that it's a oblique popliteal ligament is an extension of from the tendon of semimembranosus muscle. So if again I will highlight this diagram. So you can see here, this is the tendon of the semimembranosus muscle which I have highlighted. This is the tendon of semimembranosus muscle. From here, if you will see, the extension is there. Can you see here this extension? This extension is called as oblique popliteal ligament. So what is the origin of oblique popliteal ligament? The answer is oblique popliteal ligament is formed by the extension, aponeurotic extension you can say, of oblique popliteal ligament is actually an extension of semimembranosus muscle. So please write down, oblique popliteal ligament is extension from semimembranosus muscle. Oblique popliteal ligament is extension from semimembranosus muscle. Got it? The next important point is structures piercing. The other point which has been asked in MCQs in the previous year, and it is important for you to know that which are the structures which is piercing say this oblique popliteal ligament. So write down structures piercing. Structures piercing oblique popliteal ligament. Okay, my dear aspirants. So the structures piercing oblique popliteal ligaments are, the list of structures which is piercing oblique popliteal ligament is, it is pierced by middle genicular nerves and vessel. It is pierced by middle genicular nerves and vessels, and also by posterior division of obturator nerve. Also it is pierced by posterior division of obturator nerve. Important for MCQs. So yes, here one more ligament is important for you to know here, which is shown, arcuate popliteal ligaments. So arcuate popliteal ligament, as you can see here, it is again having an extension. Okay, so it is attached to here, when you will see the arcuate popliteal ligament, it is actually having two components and it is diverging from the head of fibula. Okay, arcuate popliteal ligament is actually Y-shaped and it is diverging from the head of fibula, and you can see here, so its stem is attached to the stelloid process of fibula. If I go more specifically, then I have to use the term, this one is the, so don't, so we have done with oblique popliteal ligament. Here this extension which you are seeing here is the arcuate popliteal ligament. So write down arcuate popliteal ligament. Arcuate popliteal ligament, what is the shape dear? Y-shaped. It is Y-shaped. It is Y-shaped. Where is the stem attached? Stem is attached to stelloid process of, stem is attached to stelloid process of fibula. Stem is attached to stelloid process of fibula. And you can see this has got an anterior limb and posterior limb. So anterior limb will arch and will go towards the intercondylar area of tibia. So when we are talking about its anterior and posterior limb, so there is anterior limb, it is having an anterior limb and it is having a posterior limb. Okay. Now the posterior limb is arching over the popliteus tendon muscle, and then it get attached to the intercondylar area of tibia, and anterior limb will go towards the lateral condyle of femur, will traverse towards the lateral condyle of femur. Now, next is transverse ligament, as you can see in the diagram. Yes, so I am focusing about this one, this ligament I am talking about, this the transverse ligament. This is the transverse ligament. Got it? This is the transverse ligament. So, transverse ligament is connecting anterior ends of both medial and lateral menisci. This is medial meniscus, this is lateral meniscus. So, what is the transverse ligament? As you can see, it is on anterior aspect connected by, so anterior aspect of both medial and lateral menisci is connected by transverse ligament. So, it is quite clear that anterior ends of both menisci connected by transverse ligament. Now, let us see the coronary ligament. So, here you can see this small ligament which you are seeing here is the coronary ligament, this one, this is the coronary ligament, okay. So, here is the coronary ligament. So, what is coronary ligament? Actually, coronary ligament is the part of the fibrous capsule itself which is providing the attachment to the peripheral margins of medial and lateral meniscus. So, coronary ligament you can say is actually an extension you can say peripheral extension of fibrous capsule which provide attachment to medial and lateral menisci of tibia from tibia. So, got it? So, done with this. So, we have finished all the ligaments. That was a very important topic about the knee joint, and we have finished all the ligaments. The next important topic which I want to tell is the bursa. So, this is a beautiful diagram in which you can see the location of important bursa in respect to the knee joint. So, you can see the location of suprapatellar bursa which is lying on the lower anterior aspect of the lateral condyle above the level of knee joint. Prepatellar bursa, actually prepatellar bursa, subcutaneous prepatellar bursa you can see, which is just anterior to the knee joint below the skin. And on the tibial part, upper tibial tuberosity, there is infrapatellar bursa, and lower it on the medial aspect of the tibia. On the medial aspect of the tibia, there is pec anserine bursa. So, actually pec anserine bursa will be lying in relation to three muscle tendons. The three muscle tendons, that is semitendinosus muscle, the sartorius muscle and the gracilis muscle, will be separated from tibial collateral ligament. It will be separated from tibial collateral ligament by pec anserine. It will be separated from tibial collateral ligament by pec anserine bursa. Suprapatellar bursa is lying on the superiorly, most superiorly, subcutaneous suprapatellar bursa just below the skin on the anterior lower aspect of the femur bone. Prepatellar bursa is just lying anterior to knee joint below the skin. Infrapatellar bursa is just over the tibial tuberosity. So, actually the location is quite clear by seeing this diagram. Now, in this diagram we can appreciate the knee joint relations. So, this is a diagram showing relations of knee joint. So, yes, anteriorly it is having ligamentum patellae, it is related with ligamentum patellae. Medial and laterally it will have medial and lateral retinacular ligaments. Anteromedially you can say most what I want to tell about its relation. So, if we go, it's towards the medial and lateral aspect. So, posteriorly we have got just the tibial nerves and the popliteal vessels, as you can see. Posteriorly we can very clearly see nerves and vessels are there. So, popliteal nerves and vessels and tibial nerves. Popliteal vessels and tibial nerves are there. More laterally, so we have got biceps femoris, plantaris, common peroneal nerve, and more medially we have got gracilis. So, anteromedially you can say gracilis, semimembranosus, semitendinosus and medial head of gastrocnemius. Other than that, sartorius is also lying there. So this diagram is giving you a clear picture of relations of knee joint. Next important point is about the blood supply of knee joint. So let's talk about the blood supply. So actually when we are talking about the blood supply of knee joint, it is basically from the genicular branches. So we know that in respect to knee joint, we have got 5 genicular branches, okay, medial and lateral, inferior genicular, medial and lateral, superior genicular. So we have got these. These arteries. So we have got middle genicular artery, we have got medial superior genicular, medial inferior genicular, lateral superior and lateral inferior 5 genicular branches of popliteal arteries. Other than that, descending genicular artery, you can see descending branch of lateral circumflex femoral artery, branches from anterior. So actually anterior and posterior recurrent branches you can see, and lateral inferior circumflex fibular arteries. So actually I would like to write the name. So all these branches together forms an important knee anastomosis. So I would like to write the name of the blood supply of knee joint. So please write down blood supply of knee joint. So the blood supply of knee joint, following sources are there: 5 genicular branches of popliteal artery, 5 genicular branches of popliteal artery, descending genicular branch of femoral artery, descending branch of lateral circumflex femoral artery, lateral circumflex descending branch of lateral circumflex femoral artery, other than that we have got recurrent branches from anterior tibial arteries, 2 recurrent branches of anterior tibial artery, and circumflex fibular branch of posterior tibial artery, circumflex fibular branch of posterior tibial artery, or posterior tibial artery. So these are the arteries which is giving blood supply to the knee joint, or posterior tibial artery. So these are the 5 sources: 5 genicular branches of popliteal artery, descending genicular branch of femoral artery, descending branch of lateral circumflex femoral artery, 2 recurrent branches of anterior tibial, and circumflex fibular branch of posterior tibial artery. Blood supply. All these are forming a important anastomosis. So if you will see this diagram, you can basically understand the knee anastomosis, which is also very important for you to understand. So let me just rub this. What you can appreciate in this diagram, that descending genicular artery, descending genicular branch from the femoral artery, as you can see, it is forming anastomosis with the medial superior genicular artery. The medial superior and medial inferior genicular artery is also forming the anastomosis. Also medial inferior genicular artery is forming anastomosis with saphenous branch of descending genicular artery. So that means descending genicular anastomosing with the medial genicular artery, medial superior genicular, and saphenous branch of descending genicular is anastomosing with medial inferior genicular, and also the 2 genicular arteries on the medial side is anastomosing among themselves. Same way, the lateral superior genicular artery will anastomose with the lateral inferior genicular artery. The descending branch of lateral circumflex femoral artery will also anastomose with lateral superior genicular, and circumflex fibular branch from posterior tibial and recurrent arteries will again and recurrent branches from anterior tibial arteries will anastomose with lateral inferior genicular artery. So this is a very beautiful diagram where we can clearly see the arteries forming knee anastomosis. So any doubt, aspirants, let me know your doubt. You can write in the message box. So we have done with this. Next important point is we have to know about the movements. So next important point is to know the movements of the knee joint. Okay, so let's proceed to locking and unlocking of knee joint. Locking and unlocking of knee joint. What is important is the muscle performing, and what is locking and unlocking of the knee joint definition is also important for you to know. So let's proceed with this. So can you see here, in the case of the knee joint being locked, all the ligaments will be taut and all the ligaments will be relaxed when the unlocking is there. So unlocking is related with the flexion and locking is related with the extension of knee joint. So please write down the definition. Locking of knee joint. And other important point which I want to correlate is quadriceps femoris muscle is very, very important for your knee joint stability. So locking of knee joint is defined as medial rotation of femur. It is defined as medial rotation of femur on tibia during terminal phase of extension. Unlocking of knee joint. Unlocking of knee joint. Define locking, now unlocking of knee joint. Unlocking of knee joint is lateral rotation of femur on tibia during initial phase of flexion. So which is the unlocker? Which muscle causes unlocking? Popliteus muscle. Which muscle is causing the locking? Quadriceps femoris muscle. All the ligaments are taut during locking of knee joint. All ligaments are relaxed during unlocking of knee joint. What is next important, which is always asked in an MCQ session and it's important for your competitive exam, is to know the muscles performing the important action on the joint. So let's talk about that and then we can proceed to the applied aspect. Okay. So flexion, important movements which takes place at the knee joint is flexion, extension around transverse axis and medial and lateral rotation along vertical axis. So flexion is primarily done by semimembranosus muscle, semitendinosus muscle and also by biceps femoris. Other than that, the muscles performing flexion is popliteus muscle, also by sartorius muscle, also by gastrocnemius muscle and gracilis. These are accessory muscle, not the primary. Extension, when we are talking about extension movement of knee joint, it is primarily done by quadriceps femoris muscle. Quadriceps femoris muscle, that is the muscles of anterior aspect of thigh, that is vastus lateralis, vastus medialis, vastus intermedius and rectus femoris. And RF rectus femoris. Also extension is done by tensor fascia lata. Medial rotation, muscles performing medial rotation. Medial rotation is primarily done by semimembranosus muscle, semitendinosus muscle, popliteus muscle, sartorius muscle and gracilis muscle. Lateral rotation is primarily done by biceps femoris muscle. Yes, Rahman, you are absolutely right, medial genicular artery. Tensor fascia lata and also by gluteus maximus muscle. So yes, done with this. Now before going to the hip joint, I would like to tell you about some of the applied aspects related to the knee joint. So osteoarthritic condition. So we have already talked about synovial fluid, and I have told you that osteoarthritic is a condition, osteoarthritis of knee joint, it's a condition when the synovial membrane, which is lining the inner aspect of the fibrous capsule, is not able to maintain its synovial fluid secretion, which is containing the important substance which is required for lubrication of knee joint and ineffective. So you can say synovial membrane is acting as a grease. You must be knowing that when you are riding the bicycles and all, you put on your bicycle oiling and greasing you do, so that its movement is quite smooth. So for any joint in our body also, we have got joints, we want that smooth movement or coordination of movement is possible. So for that हम भी चाहते कि उसमें oiling or greasing हो. So that is done by the synovial membrane. So due to old age or due to certain injuries also, there is a loss of synovial fluid, decreased amount of synovial fluid, and ultimately there will be friction in between the surfaces of the bone, which is forming the articular surfaces of the bone, and it will lead to a condition of osteoarthritis. New bone formation, osteophytes are also seen. So in this case, the presentation of the patient will be restriction of the movements and a very painful movement, and ultimate goal for the treatment now is the total knee replacement and total hip replacement, and the resultant is quite beneficial. So see here, if I enlarge this X-ray of osteoarthritic condition, so this is normal. Here this is the normal one, as you can see here, and this side is, you can see joint cavity is quite reduced. So synovial membrane and joint cavity is also quite reduced. Here a prominent joint cavity has been seen. So here the joint cavity is normal, but here the joint cavity is quite reduced. Now, one of the applied aspect is unhappy triad of knee joint. Unhappy triad of knee joint, actually in case of athletes and all, footballers, basketballers, rugby players, when there is injury from the lateral aspects and twisting injuries are there, so there is a chance of a high frequency injury is there. So there can be a chance of injury of three important ligaments together, that is called as the terrible triad or O'Donoghue or unhappy triad of knee joint. The three ligaments which is injured here is medial collateral ligament. My dear aspirants, you already know, as we have discussed, the medial or the tibial collateral ligament is adherent to medial meniscus. So medial meniscus will be also injured, and along with it, the other structure which will be injured is, so if we talk about the other structure which will be injured here is anterior cruciate ligament. So these three structures injured together is called as unhappy triad. So see here, you can see in case of O'Donoghue or terrible triad, there is torn ACL. So ACL is injured, anterior cruciate ligament, torn medial meniscus and medial collateral ligament. So medial collateral ligament is injured and that of medial meniscus is injured. Medial meniscus is injured. So got it? Now, housemaid knee. Next important point is housemaid knee. So actually housemaid knee is a condition, you can see here there is friction. There is swelling, inflammation of bursa that will lead to the condition. So here the inflammation is of subcutaneous prepatellar bursitis. Inflammation of subcutaneous prepatellar bursitis. So this is a condition of inflammation of subcutaneous prepatellar bursa leading to a condition prepatellar bursitis. Housemaid knee. Clergyman knee, this is seen in case of priests who have got an habit of kneel down and doing the prayers. So this will lead to friction over subcutaneous infrapatellar bursa. Inflammation, this is a condition of subcutaneous infrapatellar bursitis. Now, pec sensorine bursitis, here the pec sensorine bursa is involved. The bursa related to three muscle tendons separating the muscle tendon semimembranosus, gracilis muscle and the sartorius muscle, with that from the medial collateral ligament. So, if that is inflamed, this will cause pain into the medial aspect of the proximal aspect of tibia, and this condition is called as pec sensorine bursitis. So, yes, we have complete one of the joint, that is the knee joint. So, now I want to complete the hip joint, ankle joint and the other joints of the lower limb. So, let us discuss the next joint, that is the hip joint. So, hip joint, you can appreciate hip joint. Here we have got an articulation of the acetabulum, head of the femur in the acetabular cavity. So, here you can see this is the head of the femur articulating inside the acetabular cavity, and it is an example of, it is a stable joint. Why? Because the acetabular cavity is deep to accumulate the head of femur, and it is a stable joint, and the example of this joint is, it is an example of ball and socket type of synovial joint. It is an example of ball and socket type of synovial joint. Ball and socket type of synovial joint. Now, next important point is that we have to know the ligaments related to hip joint, and I would like to give you the explanation of each and every ligament the same way when we have gone through the explanation of the ligaments related to knee joint. So, each one of the ligament I will tell you about its attachments and its correlations. So, yes, write down. The important ligaments are, firstly just enumerate, I am enumerating the ligaments of hip joint, and then I will go up with the explanation of each and every ligaments. Ligaments of hip joint. So, let us talk about the ligaments. Fibrous capsule of hip joint, fibrous capsule of hip joint, iliofemoral ligament, pubofemoral ligament, ischiofemoral ligament, ligament of head of femur, acetabular labrum, transverse acetabular ligament. Okay, so these are the ligaments in relation to hip joint. These are the ligaments, and I would like to explain each one of this in brief. So, let us proceed with each one of it. So, see here, this firstly let us come up with the explanation of fibrous capsule of the hip joint. Okay, so first thing is that okay, it's a ball and socket type of joint. It's a quite stable joint. Why? Because the acetabular cavity is deepened by it's deep, and it's also having more deepening by the attachment of acetabular labrum, which is an example of fibrocartilage. So, it's a stable joint. Now, ligaments ke naam ho gaye. We have to go up with the explanation of each and every ligament. So, let's focus firstly with the fibrous capsule. Now, fibrous capsule of the hip joint, as you can see in this diagram. So, there is two images which is shown here. So, this is the anterior view, and here will be the posterior view of the fibrous capsule. So, what I want you to explain is the attachment of fibrous capsule on the anterior aspect. So, one is the cadaveric image and the other one is a schematic diagram to make you understand. So, fibrous capsule, if you will see, it is attached onto the acetabular margins. It is attached here on the upper aspect. So, it is the anterior view of fibrous capsule, anterior aspect. So, it is attached to the acetabular margin, this dotted line, okay. half to 1 mm beyond the acetabular margin, and lower down it is attached to which line? Lower down it is attached anteriorly to intertrochanteric line. And here the ligament which is shown here, this one, this is the fibrous capsule which you are seeing. This is the fibrous capsule. Now moving on to the posterior view. So here you are seeing the posterior view of the fibrous capsule attachment. Again, on the posterior aspect it is attached superiorly to acetabular margin, but lower down you can see it is attached here, that is intertrochanteric crest. So it is attached 1 centimeters or 2 centimeters, approximately 1 to 2 centimeters superior to that of intertrochanteric crest. So this is how, and here you can see this exactly is the fibrous capsule. This exactly is the fibrous capsule, which is not exactly on the intertrochanteric crest posteriorly, but it is, its attachment is lying 1 to 2 centimeter above the intertrochanteric crest. So now my dear aspirants, you already know fibrous capsule के inner aspect पे which structure is attached? Synovial membrane is there, and together fibrous capsule of the hip joint along with the synovial membrane lining the inner aspect of fibrous capsule, it is called as articular capsule. Same way as we have discussed in the knee joint. Now let's proceed to the other important ligaments. I would like to show you the image first and then I will come up with the explanation. In this diagram you can appreciate 3 ligaments. Okay, so anterior and posterior view of the hip joint has been shown, and you can see a Y-shaped ligament. So let me again highlight this diagram. So let me just show you a better picture. So I have just highlighted this diagram, enlarged this. So this is iliofemoral ligament which is Y-shaped. As you can see, it is Y-shaped. This is iliofemoral ligament which is Y-shaped, as you can see here. So this will be the stem or superior attachment, and this is the lower inferior attachment. Okay, so this is Y-shaped, and you can see the other ligament that is called pubofemoral ligament is merging with the iliofemoral ligament. The posteriorly you can see we have got ischiofemoral ligament. Okay, so my dear aspirants, iliofemoral ligament is attached superiorly to anterior inferior iliac spine lower part, and lower down it is attached to intertrochanteric line. Yes, hello Hassan, intertrochanteric line. Got it? और अगर हम pubofemoral ligament की बात करेंगे तो it is attached to superior ramus of pubis, iliopubic eminences and blending with the fibrous capsule. Posterior view में हम देखेंगे ischiofemoral ligament which is attached from the acetabular and acetabular aspect and going towards the greater trochanter of femur. So let's write about the attachment of each one of this ligament, and then we will proceed to the other ligaments. So let's write each one of this ligament. Okay, so firstly I would like to write about iliofemoral ligament. Iliofemoral ligament. Iliofemoral ligament is Y-shaped ligament, The apex of iliofemoral ligament is attached to anterior inferior iliac spine lower part. To be more specific, base of iliofemoral ligament is attached to, base is attached to intertrochanteric line. Intertrochanteric line of femur. Got it? Intertrochanteric line of femur. Actually, when we talk about this iliofemoral ligament, which is one of the strongest ligament in our body and which is preventing our body from falling backward. Okay, it is preventing our body from falling backward. Okay, so it is having actually when we will see, it is having a lateral thick band. So it will have a lateral thick band. It will have a medial band. It will have a large central band. It will have a large central part which is thin. It will have a lateral thick band, and medial is also thick part which is exactly in the vertical fibers के direction में होगा और lateral वाला oblique direction में होगा. These are the fibers or of iliofemoral ligament. Okay, now please note down and that it's one of the strongest ligament in our body, and it is preventing our body from falling backward. It prevents our body from falling backwards. Now, pubofemoral ligament, when we are talking about pubofemoral ligament, so pubofemoral ligament. Pubofemoral ligament is pubofemoral ligament pubofemoral ligament is triangular in shape. Apex, it is also having apex and the base, and it is attached, it is merging with infromedial, it is giving infromedial support to the joint, hip joint, as it is merging with the fibrous capsule. Also, its attachment is upper aspect, it is attached to, in the superior aspect or upper aspect, it is attached to iliopubic eminences, superior ramus of pubis, obturator crest, it is attached to obturator crest, and inferiorly it blends with, inferior aspect it blends with medial band of iliofemoral ligament. Now, coming to the other ligament, ischiofemoral ligament. When we are talking about ischiofemoral ligament, the ischiofemoral ligament is attached, it is giving posterior support, and it is attached to the ischium of the hip bone to the acetabulum part also, and get attached to the femur greater trochanter, and it gives posterior support to the hip joint. One more point I want to add on, please note down. If we talk about three ligaments, that is iliofemoral ligament, it is preventing hyperextension of our body. So, it is preventing. So, when we are talking about iliofemoral, जब हम iliofemoral ligament की बात करते हैं, जब हम pubofemoral ligament की बात करते हैं, और जब हम ischiofemoral ligament की बात करते हैं. So, what is its function? Please note down. It's preventing hyperextension, prevents hyperextension of the hip joint. So, preventing the body from falling backward. Pubofemoral is limiting, means hyperabduction, and ischiofemoral is limiting excessive internal rotation of hip joint. So, this is the function of these three ligaments. Now, let us focus on some of the minor ligaments. So, here you can see the minor ligaments. So, in this diagram, let me just highlight this diagram. So, this is showing you the ligamentum teres. So, when you will see the head of femur, in the head of the femur, what you can appreciate, that here there is a cavity, there is a depression lying in the center of head of femur. That depressed area, we are talking about this, that depressed area is called as fovea capitis. So, that depressed area is fovea capitis, which is in the center of the head of femur, where the depression is fovea capitis. And you can see ligament of head of femur is attached here. This is ligament of head of femur, which is also called as ligamentum of teres, which is attached to the fovea capitis, and lower down its basal aspect is merging with. So, here you can see lower aspect, its basal aspect is merging with transverse acetabular ligament. So, here this hole is the acetabular cavity, and lower aspect, this notch is acetabular notch. So, this notch is actually acetabular notch, and on the acetabular notch, this ligament is transverse acetabular ligament. This is transverse acetabular ligament, and you can see here ligament of head of femur, which is, this is ligament of head of femur, ligament of head of femur, or that of ligamentum teres, which is blending lower aspect. The acetabular notch is traversed by a bridging of transverse acetabular ligament. Okay, and the whole acetabular cavity is deepened by the attachment of acetabular labrum. So these are minor ligaments, just one line each about these ligaments. So let's focus minor ligaments. One is acetabular labrum. Acetabular labrum is what it is made of. It is made of fibrocartilage. It is made of fibrocartilage, which deepens the acetabular cavity. It deepens the acetabular cavity to support the head of femur in the acetabular cavity. Other than that, we have got transverse acetabular ligament. Transverse acetabular ligament. So when I am talking about transverse acetabular ligament, it is bridging. It bridges the acetabular notch. It bridges the acetabular notch. Ligament of head of femur. Ligament of head of femur is attached to fovea capitis. It is attached to fovea capitis and blends lower down. So apex, if we talk about apex, is attached to fovea capitis of ligament of head of femur, which is also called as ligamentum teres or round ligament of head of femur, blends with transverse acetabular ligament. Blends with transverse acetabular ligament. Got it, everyone? So yes, so we have done with all the ligaments also. Now next is the movements of the hip joint. Okay, so movements, arterial supply, nerve supply is remaining. Okay, so we will talk about that. Okay, movements of hip joint. Movements of hip joint. Okay, so yes, movements, nerve supply and artery. So you can see here flexion extension movement along flexion extension transverse axis, abduction adduction, external internal rotation along the vertical axis, abduction adduction is anteroposterior axis. So these are the three kinds of movements which is occurring in the three planes, and we have to know individually each action performed by the muscles group. So we will talk about this. Now also before that, let's firstly let me tell you about the nerve supply and the arterial supply. So write down arterial supply of hip joint. Arterial supply of hip joint. The arterial supply of hip joint is, yes dear, you can write your doubts in the messages also, don't worry. And one of the basic point is that 6 p.m. all of you should download the Unacademy app and we will discuss MCQ related to this topic. So today I am going to cover all the joints of the lower limb, so it will be followed. So I will cover up the session in another 40 minutes, 30 to 40 minutes I will cover up all the joints, 40 minutes all mujhe lagenge 30 minutes. Then 6 p.m. say after you will get a break of 30-40 minutes and then you can join me for the 6 p.m. session MCQ discussion of the topic which I have described. Okay, now arterial supply of hip joint is by medial circumflex femoral artery, lateral circumflex femoral artery, obturator artery, superior gluteal artery, inferior gluteal artery. Okay, medial circumflex femoral, lateral circumflex femoral, obturator, superior gluteal artery and inferior gluteal artery. Actually, one of the best and the most important arterial supply is given by medial circumflex femoral artery, that is giving acetabular branches, and major chunk of blood supply to the head and neck region of the hip joint is given by medial circumflex femoral artery along with the acetabular branch of obturator artery. Nerve supply. The nerve supply of hip joint, the important nerves giving innervation to hip joint is femoral nerve, via nerve to rectus femoris, via nerve to rectus femoris. Obturator nerve, that is actually anterior division of obturator nerve. Accessory obturator nerve, accessory obturator nerve. Then we have got nerve to quadratus femoris, nerve to quadratus femoris. Other than that, superior gluteal nerve. So these are the important nerves, and okay, and sometimes also it takes twigs from sciatic nerve. So also sometimes twigs or a small branch from sciatic nerve is given to the hip joint. So these are all basically important nerves which is giving innervation to hip joint. Now let's focus on to the movements. Okay, so let's focus on to the movements, and then we can also proceed to the ankle joint. So crux point I am talking about. Okay, we could have an elaborate form of applied aspect to the hip joint also, but crux point is important to know. So now I will proceed to the movements, and then I will proceed to ankle joint. Mnemonic for blood supply and nerve supply. Okay, my dear aspirants, if I talk about blood supply के लिए mnemonic, so actually medial lateral circumflex femoral artery and obturator artery, actually you can remember it by circumflex femoral artery. Okay, circumflex femoral arteries are very, very important for hip joint. In that category also there is medial circumflex femoral artery. Yes, actually mnemonics are very good, but why I am not so much of favor of mnemonic, I will tell you one of the reason. Because nowadays what has been seen that direct question doesn't come here. Okay, they are increasing the standard of questions. They want you to solve clinical MCQs and all. So mnemonic से exactly हमें highlight नहीं हो पाता है. But it is easy to, you can correlate. Okay, अगर हम hip joint की बात करें तो it is one of the most important thing which I tell you to know is the medial circumflex femoral artery is most important. Okay, Raja, so medial circumflex femoral artery is most important blood supply. Other than that, we have got obturator and lateral circumflex. So ये जो upper three artery है, ये आप मत forget करो. Okay, my dear aspirants, Raja, this first three arteries please don't forget. Medial circumflex, lateral circumflex and obturator artery. उसमें भी most important है medial circumflex femoral artery. Nerve supply में very easy to remember. Femoral nerve, obturator nerve is the important nerves. Okay, so femoral nerve will give, we know that nerves of lower limb में कौन से important होते हैं? Femoral, obturator, and we know that sciatic nerve is the long nerve. So sciatic nerve is giving twig, and femoral and obturator nerve is giving basically the major innervation. So what is asked is movements. जो MCQ target होता है Raza is from the movements. Okay, so see here, let's talk about the movements of hip joint. So let's firstly talk about the muscles producing flexion of hip joint. So here also one of the important point is that the primary flexors of hip joint is not the muscles of exactly lower limb, it's the muscle which is coming from the upper aspect lumbar region. And what is that muscles? That is psoas major muscle, iliacus muscle, pectineus muscle, sartorius muscle, and also by rectus femoris muscle. These are the primary flexors of hip joint. Extension. Now coming to extensions of hip joint. The muscles causing extension of hip joint, they are basically gluteus maximus muscle and that of hamstring muscle. So which are the hamstring muscle dear? Which are the hamstring muscle? The hamstring muscles are The muscles of the back of thigh. And which are these muscles? Hamstring muscles are muscles which is lying on the back of thigh, and these muscles are, what is the name? Semitendinosus. The muscles are semitendinosus, semimembranosus, long head of biceps femoris, and adductor magnus muscle, hamstring part. So these are the muscles. Okay. So we have done with the extension. Coming to abduction and adduction. Adduction of hip joint, the muscle causing adduction of hip joint. The muscle causing adduction of hip joint is adductor magnus, adductor longus, adductor brevis. Also pectineus and gracilis muscle, muscles of medial compartment of thigh. Abductors of hip joint, the muscles are gluteus medius, gluteus minimus are abductors of hip joint, along with tensor fascia lata. Which is remaining, dear? Medial and lateral rotation is remaining. So let's talk about medial and lateral rotators. So let's talk about medial and lateral rotator muscles. So medial rotation of hip joint is done basically by which muscles? Anterior fibers of gluteus medius and minimus muscle, along with tensor fascia lata. What about lateral rotators of hip joint? All the small muscles which is lying under the cover of gluteus maximus muscle. So which are they? The muscles are piriformis muscle, quadratus femoris muscle, gemellus superior and inferior, gemelli superior, gemelli inferior, obturator internus and obturator externus muscle. So these are the muscles which are lateral rotators under the cover of gluteus maximus muscle. So yes, done with this. Now basically we will move on to the next one, that is the ankle joint. So let's talk about ankle joint. Actually hip joint, knee joint and ankle joint we will discuss in detail, and thereafter the other smaller joints we will know the type of joints. So ankle joint is another very stable joint hai. Why? I will tell you, because this ankle joint is, let me explain by elaborating this diagram and then we will move on with the other one. Okay, see here. So when I am talking about ankle joint, let me elaborate this diagram. Yeah, this is the enlarged view. So what you can see, it is formed by the lower end of the tibia. Lower end of tibia is called as medial malleolus. Lower end of fibula is called as lateral malleolus. Okay, list of extensors. Okay, see here. These are the extensors, dears. See here, these are the extensors of the hip joint. Okay, these are the extensors, gluteus maximus and hamstring muscle. Hamstring muscle matlab semitendinosus, semimembranosus, long head of biceps and adductor magnus. And these are the list of muscle which is causing flexion of hip joint. Psoas major, pectineus, iliacus, rectus femoris. Okay, Raja? Okay, Raja? Now, so okay, I was here. So, okay, here you can clearly see that medial malleolus along with the lateral malleolus, on the superior aspect and along with the inferior tibiofibular ligament is forming a superior. So, what will it together form? It will form a superior motice. It will form a superior tibiofibular motice which is articulating with, which will articulate with the talus bone superior aspect along with medial and lateral articular surfaces of the talus to form a stable ankle joint, to form a strong stable ankle joint. So, all of you please write down. Ankle joint is is again a variety of hinge joint, and its proximal articulation is hinge joint, and its proximal articulating surface is formed by medial malleolus, lateral malleolus, and by inferior transverse tibiofibular ligament, inferior transverse tibiofibular ligament. Got it? So, together these three structures, medial malleolus, lateral malleolus, tibiofibular ligament, these three structures together is forming what? It is forming tibiofibular mortise. It is forming tibiofibular mortise. This will articulate with the distal articulating surface. So, we were talking about the proximal one, now we will talk about the distal one. So, this will articulate with the distal articulating surface distally by the upper, that means superior or trochlear surfaces of the talus, along with its medial and lateral aspect, articulating aspect of the talus bone. So, this will together leads to the formation of ankle joint. Now, let us talk about fibrous capsule. Fibrous capsule of the joint. Fibrous capsule of ankle joint. When we are talking about the fibrous capsule of ankle joint, it completely encloses the joint. It completely encloses the joint. It completely encloses the joint with two important characteristic feature here I want to point out. One is that posterior-superiorly it is attached to inferior, posterior-superiorly it is attached to inferior transverse tibiofibular ligament. And antero-inferiorly it is attached to the dorsum of the neck of talus. It is attached to the dorsum of neck of talus. Okay, and we already know that inner aspect of fibrous capsule is having synovial membrane. If we talk about the inner aspect of fibrous capsule, it will have a synovial membrane which is required for the joint lubrication. We have already talked. Other than that, what is very important for you to understand is the ankle ligaments. So, ankle joint, two important ligaments attachment you have to know. One is the medial ligament of ankle joint, another is the lateral ankle ligament attachments. So, I would like to explain these two ligaments via this diagram which will help you to understand. So, see here. So, I would like to enlarge this image. Okay, my dear aspirants, yes. So, here you can see, if I talk about the superior attachment of the, so see here. Superiorly it is attached to MM. What is MM? Medial malleolus. Okay, so medial malleolus. Superior attachment, actually this medial ankle ligament which is also called as the deltoid ligament. What is the other name? It is also called as the deltoid ligament. So, this deltoid ligament or medial ankle ligament is having a 4 parts. Okay, it is having a anterior. So, you can see here it is having anterior tibiotalar parts, tibionavicular, tibiocalcaneal and posterior tibiotalar part. Superior attachment is similar, that is medial malleolus, but when it is going lower down, it is diverging and attaching to the corresponding bone. So, let me use so see here, this is the tibiocalcaneal part which I am highlighting with the green color. So, this is the tibiocalcaneal part. It is merging with the sustentaculum talus of the calcaneum bone. Okay. So, done. This is the tibiocalcaneal part. Okay. Now, we are talking about the tibionavicular. So let me show you the tibionavicular part. So you can see here I am using this pink color for tibionavicular part. So tibionavicular, and lower down this is merging with another ligament, that is plantar calcaneonavicular ligament, which is also called a spring ligament. So yes, this is the tibionavicular part of the ligament. Superior attachment is similar. It is attached to this bone, N for navicular bone, and it also merges with this ligament, that is spring ligament. The other name of the spring ligament is plantar calcaneonavicular ligament. So a better view. So let me just, plantar calcaneonavicular. This is which ligament? This is plantar calcaneonavicular ligament, which is also called a spring ligament. So it is merging with the spring ligament as shown in the diagram. Then now two more extensions. So you can see here from the lower aspect of the medial malleolus, two extensions are there. One is posterior tibiotalar, other is anterior tibiotalar. So this is going towards the talus bone. This merging is going towards the talus bone. So altogether the deltoid ligament is having 4 components, which is quite clear in this diagram, and I have explained it. So let me, if you want, I will write in the brief, or is it okay? Let me know. So quickly, if you want, I will write it. Okay. So deltoid ligaments, deltoid ligament of ankle joint, deltoid ligament of ankle joint, deltoid ligament of ankle joint. Superior attachment is medial malleolus, which we already know, medial malleolus of tibia. Inferior attachment is occurring to the 4 parts. So inferiorly it is having tibionavicular part, it is having which is attached to navicular tuberosity. So and it is having tibiocalcaneal part. The tibiocalcaneal part is attached to the length of sustentaculum tali, length of sustentaculum tali. Okay. Got it? The first part, this is the third part. Stronger ligament, delta shape. Deltoid means generally there is a deltoid muscle, so we tell that its shape is delta, so only. So like that it is diverging and shape, so that would be the reason. Yeah. Tibiocalcaneal, divergence is there. Strong, it's very strong also. Tibio, then we have got posterior tibiotalar part, and we have got anterior tibiotalar part, anterior tibiotalar part. So anterior and posteriorly attaching to the tibia, that is anterior and posteriorly attaching to the tibia. Okay, so this is the whole of the deltoid ligament of the ankle joint, and let's talk about the lateral ligament. So see here, in this diagram you can see the lateral ligament, where you can see anterior talofibular ligament, you can see posterior talofibular ligament and calcaneofibular ligament. So actually here also, if you talk about superior attachment, if I talk about superior attachment of lateral ankle ligament, superior attachment. So superiorly it is attached to the lower end of fibula bone, that is called as lateral malleolus. From here it is diverging into 3 parts and forming 3 ligaments. One is anterior talofibular, posterior talofibular ligament and calcaneofibular ligament. Got it? So you can see here the 3 direction is the divergence, as you can see here, that is the anterior talofibular, it is the anterior talofibular, then we have got posterior talofibular, and then we have got calcaneofibular. Calcaneofibular is attached to the Calcaneofibular is attached to the lateral surface tubercle of calcaneum, lateral surface of the calcaneum bone, that is the heel bone, and anterior and posterior extension towards the talus bone from the lateral malleolus has been shown. So, done with this. Now, next is to know the relations of ankle joint. Next is very important for you to know the relations of ankle joint. MCQs come from that point. So, write on the heading, relations of ankle joint. See here. So, for it I would like to draw a diagram for you. So, medial malleolus है, ये lateral malleolus है, this is the talus bone. Okay. This is just a systemic view, schematic diagram to make you understand important relations. So, yes. So, इसका मतलब MM means यानी this would be the medial side and this would be the lateral side. This is quite clear. Okay. So, when we are talking about anterior relation, so this will be and here this will be A for anterior and here this will be P for posterior. So, write down. So, here the structures related on anterior aspect as we move from medial to lateral will be. So, I would like to draw some muscles tendon. Okay. So, see here. This is the muscle tendon. So, from medial to lateral, the first structure will be tibialis anterior, extensor hallucis longus, then we will have the artery, anterior tibial artery, then we will have the nerve, that is DPN, that is deep peroneal nerve, then we have got extensor digitorum longus and PT for peroneus tertius muscle. So, these are the muscles which is crossing the anterior aspect, and relations, these are also exactly the relation for the structures crossing below the extensor retinaculum of ankle joint. Same way, when we talk about the posterior relation, I would like to draw the muscle tendons related from medial to lateral. So, there will be this is again the muscles, then coming up with the labelings. Okay. So, most medial most will be tibialis posterior muscle tendon, then will be flexor digitorum longus, then will be posterior tibial artery, then is the tibial nerve, tibial nerve, and lastly the tendon of flexor hallucis longus. Now, if I talk about the laterally, we have got two muscle tendons related laterally to ankle joint. They are peroneus brevis and that of peroneus longus. So, these are the structures which is in relation to the ankle joint. Okay, relations of ankle joint. So, we have done with this. Now, let us move on to the arterial supply and nerve supply. Arterial supply. The arterial supply is by malleolar branches of anterior and posterior tibial arteries along with peroneal arteries. This is the arterial supply. Now moving with the nerve supply. Nerve supply is by deep peroneal nerve and that of tibial nerve. Okay. Now coming to the actions, so yes, it's a hinge joint and it's having only two actions, that is dorsiflexion. Two actions are occurring on the ankle joint, dorsiflexion and that of plantar flexion. So muscles causing dorsiflexion of ankle joint. The muscles are tibialis, anterior extensor digitorum longus, extensor hallucis longus and peroneus tertius. I have written in short form. The muscles causing plantar flexion of ankle joint. Muscles causing plantar flexion of ankle joint, the muscles are gastrocnemius muscle, plantaris muscle, tibialis posterior, flexor digitorum longus and flexor hallucis longus. These are the muscle which is causing plantar flexion of ankle joint. These are the two actions which is occurring at the level of ankle joint. These are the two actions. Now, okay, before proceeding to the next, I would like to tell you a few points about the applied aspect of ankle joint. Applied. So actually the most common injury in the case of ankle is the most commonly injured joint. Ankle sprain is there, but it is not dislocated much or fractured, but this the important thing is ankle sprain occur. When the sprain occurs, there is stretching of mainly lateral ligament which occurs, and to be more peculiar, which ligament is stretched, so please write down the name of the ligament being stretched is anterior talofibular ligament is being stretched. Because deltoid ligament, as you can see here, it's a strong one. Okay, Raza, deltoid is very strong, so it is having various components, so it's less chance that it will get injured. The other applied aspect is sports fracture. So when we are talking about sports fracture, it occurs in the ankle joint when the ankle joint is forcefully everted, and the injury occurs in the sequence. The first sequence of injury is oblique. There will be an oblique fracture for lateral malleolus. It will be followed by a transverse fracture of medial malleolus, which will be again followed by a fracture of posterior margin of lower limb, fracture of posterior margin of lower tibia. So this is how the sequence of fracture, and actually it is called as bimalleolar fracture, but when the posterior margin of lower tibia is involved, it changes its name to trimalleolar fracture. Trimalleolar fracture. So yes, we have done with this. Now let's move on to the few other joints. So I would like to describe the other joint and just brief the type of joint. Don't worry, we have discussed much detail of knee joint, hip joint and ankle joint. The other joint which I want to explain in brief. So see here, actually there is two type of talocalcaneal joint. There is posterior talocalcaneal joint articulation which is called a subtalar joint. So let me just highlight this diagram where you can see this is the subtalar joint. Subtalar joint is an articulation between the calcaneum and that of talus bone posteriorly. Anteriorly, the articulation between talus calcaneum will also take the navicular bone in the articulation, that is called as anterior talocalcaneal navicular. So that is roughly ball and socket type of joint, and subtalar joint is the joint where inversion and eversion of the foot takes place. So see here, if I want to highlight this diagram, what I want you to show that if you will see here in this diagram, you can clearly see that talocalcaneal navicular joint, that is an anterior articulation which is taking place between the navicular bone, between the T for the talus bone and C for the calcaneum bone. So this anterior articulation between talus, navicular and calcaneum bone is an example of ball and socket type of synovial joint. and the posterior articulation which is taking place between the talus and the calcaneum bone is called as subtalar joint. So yes, please write down here. See here, anterior calcaneo-navicular joint, anterior talocalcaneo-navicular joint. This is an example of ball and socket type of synovial joint. Roughly it is an example of ball and socket type of synovial joint. Subtalar joint. Now coming to the subtalar joint. Subtalar joint is called as posterior talocalcaneal joint. Talocalcaneal joint. Posterior talocalcaneal joint. So posterior talocalcaneal joint is an example of plane type of synovial joint. It is plane type of synovial joint. Okay dear. Now moving to the another one where you can see the calcaneo-cuboid articulation. So which movement takes place at subtalar joint is the inversion and eversion done by the peroneus longus and peroneus brevis. Calcaneo-cuboid joint, as you can see, it's an articulation between the calcaneum bone and the cuboid bone, and it's an example of saddle type of articulation. So calcaneo-cuboid joint is an example of saddle type of synovial joint. Saddle type of synovial joint. Saddle type of synovial joint. Now the other joints. So you can see here the green color joint which is highlighted is metatarsophalangeal joint. So metatarsophalangeal joint is an example of ellipsoid variety of synovial joint. Proximal distal interphalangeal joint is an example of interphalangeal joint. Intermetatarsal plane type of synovial joint, and tarsometatarsal joint is an example of plane type of synovial joint. So I would like to write this detail. So all of you please write down. Tarsometatarsal joint. Tarsometatarsal joint is an example of plane type of synovial joint. Metatarsophalangeal joint. Articulation between the phalanx and the metatarsal bone. It's an example of ellipsoid variety of synovial joint. Ellipsoid variety of synovial joint. Functionally, it's an example of ellipsoid variety of synovial joint. Structurally, it is condyloid joint. Interphalangeal joint. Interphalangeal joint, that is distal and proximal, both proximal and distal, is an example of hinge variety of synovial joint. Hinge variety of synovial joint. It's an example of hinge variety of synovial joint. My dear aspirants, also the articulation between the tarsal bones and all are example of intertarsal joints, all examples of plane type of synovial joint. Okay. Now let's talk about the three articulation between tibia and fibula joints. So here you can see this is a diagram. Where you can see the articulation between tibia and fibula bone. So here we have got proximal articulation, we have got distal articulation, that is proximal and distal tibiofibular joint, and the middle tibiofibular joint. So this is also asked in an MCQ and it's very important. So write down, this is important for MCQ. Inferior tibiofibular joint. Inferior tibiofibular joint is an example of syndesmosis. Syndesmosis type of joint. Middle tibiofibular joint. Middle tibiofibular joint is an example of fibrous joint, fibrous articulation here, and proximal or superior tibiofibular joint, proximal or superior tibiofibular joint. It's an example of plain type of synovial joint. So you can see the two joints articulating is having three types of joints. Inferior is syndesmosis, middle is fibrous joint, proximal or superior is plain type of synovial joint. It's the plain variety of synovial joint. So this is how the articulation occurs. And very clearly we have seen the different type. Any doubt, let me know. So any doubt you can ask me, okay. And also before ending, so we have done with the joint, but before ending, what I want you to know, before ending this session, I would like to tell you that we have already covered, in this session we have covered the whole topic of joints of lower limb today. Okay, we have covered knee joint, we have covered the hip one, we have covered the ankle and the other joints. Now 6 p.m. session, my dear aspirants, 6 p.m. session is the special class, okay. So that is a free special class on the platform of Unacademy. My dear aspirants, Unacademy platform पे free special session है जिसमें MCQs discuss होगा joints of lower. All of you do join 6 p.m. session. That will be a session of 40-50 minutes only. I will discuss 25 to 23 MCQs related to the topic, and that will be highly beneficial for you to cracking the exams. Okay, so do join. For that you have to download the Unacademy app. सबसे पहले आपको क्या करना है, आपको डाउनलोड करना है Unacademy app. You have to download the Unacademy app. Then you have to find your goal as NEET PG. Okay, you have to find your goal as the NEET PG, and the link of the session will be provided. Link of session कहाँ मिलेगा आपको? Let's crack NEET PG platform, INICT NEET PG Unacademy group. So there the link of the session will be provided. So via that link you can go directly to the session. If you are seeing the session in the mobile, you have to download the Unacademy app. You can see the session in the iPad, you can see the sessions in the laptop. So for that you have to firstly download the Unacademy app, और via directly also in the laptop link के directly आप sessions देख सकते हो, but you have to use an unlock code. My dear aspirant, the unlock code is ANAT10. So if you want to see the session, use the unlock code ANAT10 and be present for the free live sessions on the Unacademy platform. That will be highly beneficial for you. Before ending the session, I would like to give you certain information, my dear aspirants. So the information is that the subscription of NEET PG Iconic and Plus subscription is going at a very discounted rate. Okay, a very discounted rate is going on. You can just take the benefit of this session. So actually 10% discount rate is already going on, and you will get another 10% discount by using my code ANAT10. So you can use my code ANAT10 and you will get an additional discount of 10%. So what does that mean? A total of 20% of discount or more. So a total of 20% discount or more can be availed by you, and if you are deciding and if you are planning to take the subscription, this is the right time where you can go for this subscription. So what I will tell, if you are a student of first year, just go for 3 to 4 years of subscription minimum, because your university exam, prof exam of MBBS will be cleared. Along with it, your also preparation of next will be done. Okay. Also the students who are in final year can take 1 or 2 years of subscription. Interns going students can just take 1 year of subscription and go for Iconic subscription if the target is NEET PG, INICT or next examination. So you can either go for Plus where live session is there. So that totally depends on you. Use this code ANAT10 and avail the opportunity of getting 10% discount. So just go for it. It will be highly beneficial, dear students. Now, my dear aspirants, I also want to tell that before ending the session, so thank you so much for this session, attending this session, and also I want to tell that for watching the session, you have to download the Unacademy app. So download the PDF notes. Some of the students get confused by this. Actually, this property of downloading the PDF notes is present on the free platform of Unacademy. So you have to download the Unacademy app. You have to download the Unacademy app. Thereafter, you have to find your goal as the NEET PG, and you have to download the app from the Play Store, find your goal as NEET PG, and thereafter you can attend my 6 p.m. session, which is MCQ related. The session is MCQ related to ज्वाइंट्स ऑफ लोअर लिम्ब, ज्वाइंट्स ऑफ लोअर लिम्ब आज मैंने पूरा टॉपिक खत्म किया है. आई हैव ऑलरेडी फिनिश्ड ज्वाइंट्स ऑफ लोअर लिम्ब. सो यू कैन ज्वाइन मी फॉर द MCQ discussion. 6 PM is the timing. You can join it. Use the code ANAT10 to unlock the session and do present for this session. This will be highly beneficial for you. So do like, subscribe. Let's Crack NEET PG platform. All the links of the session is provided on Telegram group link of Let's Crack NEET PG platform, also on INICT Unacademy. Also my all information of classes are shared there. All the best. Keep studying. Thank you so much. Thank you dear aspirants. Thank you. Let's meet 6 PM session में हम मिलते हैं with the MCQ discussion. Thanks everyone. Thank you everyone. Thank you aspirants. Thank you.